We're going to take a minute. Ijeoma, you're on mute.
Yes, I wanted to. You want me to be unmuted? Okay.
All right. So welcome back. It's been an incredible day of information about important health issues affecting our community. And we're learning more. That's giving us more confidence to be advocates for our own health. And that's what this particular session is all about. Once again, I'm Colin Rock, head of partnership development here at Black Health Matters. And we want to talk again about how taking this information and turning it into strengthening and confidence for ourselves. And so we're talking again about how to become an advocate for your health. Compared to our white counterparts, African Americans are generally at higher risk for all of the things we've been talking about: heart disease, stroke, cancer, asthma, influenza, pneumonia, diabetes, and HIV/AIDS, according to the Office of Minority Health. Part of the Department for Health and Human Services says that we experience a multitude of disadvantages within the sphere of healthcare and medicine, a fact that has been highlighted by the disparities faced by African Americans in the midst of the COVID-19 pandemic. Now, more than ever, it is important for us to take the steps necessary to become our own health advocates. Today, we have Dr. Ijeoma Nnodim Opara. She's a doctor and a fellow of American Academy of Pediatrics and is a double board certified assistant professor of internal medicine and pediatrics while serving as a chief resident, the associate program director, and the associate program director of the internal medicine pediatrics residency, and an attending physician with the Wayne State University Physician Group. She is co-founder and director of the Wayne State University Global Health Alliance, okay? A multidisciplinary organization created to unify university and regional global health practitioners and create a collaborative community of best practices in global and urban health. Dr. Nnodim Opara provides clinical care to a chiefly underserved population and supervises resident clinics and teaches inpatient and ambulatory medicine. Dr. Nnodim Opara, welcome, and thank you very much for sharing your insight in this particular part of our session today.
Thank you so much. You're so kind. Can you hear me okay?
Yes, we can.
All right. Thank you for that kind introduction. And good afternoon, everyone. Welcome to this session. I'm so privileged to be able to share with you this afternoon, and hopefully we'll learn a few things. And I'm looking forward to your engagement with your questions and your answer and your comments and your reflections. With that, let me go ahead and share my screen. Okay. All right, sir. Are we in order? Can you see my screen okay?
Yes.
All right, perfect. So this afternoon, we're going to talk about self-advocacy. That's the goal of today's conversation. How do we speak up on what are best practices as it relates to advocating for our own self-health care? Again, my name is Dr. Ijeoma Nnodim Opara. I'm an internal medicine and pediatric physician at Wayne State University with Wayne Health and the Detroit Medical Center. And I do a lot of work in terms of education, research, and practice as it relates to health equity and justice and anti-racism in our community and in the, especially within the healthcare system. and how it impacts our health outcomes as it relates to affecting the things we call social determinants of health, which essentially are those conditions in which we live, work, and play. You know, our schooling, education, and income, etc., etc., early childhood experiences, all those things. So that's kind of the space in which I work. And just so that you have a little bit of a background on me, I'm also a mom and a wife. I have 3 little girls that I'm very proud of, and you might be hearing their expressions from time to time, but that's all right. So today, there are 3 things that I would like for you to walk away from, with, I should say. I hope that we all walk away with today, which is one, that you understand important strategies when it comes to advocating for your health, that essentially it will lead to ultimately having an awareness of how to build effective partnerships with the healthcare professionals in your life, and to at least begin to explore examples of health advocacy support resources, at least to list them. So, you know, I wanted to solicit the assistance of a wonderful lady, Miss James. This is not her real name, and this is not her real picture, but a patient that she's almost like a composite of so many different patients that I take care of in my practice. And so this is Miss James. She's a 39-year-old cis woman. And I would like for you to kind of follow me, follow along with Miss James, and think about her and see if you can relate to her and her story, and if that somehow speaks to your experiences as it relates to advocacy for your health, because I want you to be able to help Ms. James to advocate for her health as she goes through this journey. Okay, can we do that? Yes. So Ms. James is a 39-year-old woman, cis woman, of African descent. She has a chronic condition. She has diabetes and she has asthma. She's a school teacher by profession. At the same time, she's going back to school, or she's going to school or continue her education to get a master's in education. She has 3 children, and her first child will be graduating high school in the spring. At this time, she's stressed. There's a lot going on in her life, as you well can imagine. Compounding all of that, sort of involved with all of that, is the fact that her diabetes and asthma are not well controlled. Her sugars are staying high. She's fighting herself using her inhalers multiple times throughout the day. Now, she wants to be healthy, and this is a very important point. She wants to be healthy. She wants to be there for her children. She wants to be there for herself. But you know what? She's had a number of negative experiences in the past with doctors, where she did not feel heard, she did not feel valued, she did not feel that the advice they were giving her were realistic to her, that they were considering her her realities in their advice. So she's kind of hesitant to go out there and seek medical care. And when combined with her busy life and the stress of managing all her many commitments, ultimately her health care has worsened, as you can imagine. Again, she recognizes that she wants to take control of her health, and that in order to do that, she will need a stronger relationship or partnership with her doctor. So she's coming to us today because she wants to establish care with a new doctor, and she needs help from all of us to create a plan so that she can effectively engage with her doctor and be a better advocate for herself. Okay? Can you relate to Ms. James? Or maybe not you, but is there someone in your life you think can relate to Ms. James? I'm sure all of us can, in some way, form, or fashion, can relate with Ms. James. I am a physician and I can relate with Ms. James, okay? Because I've had my experiences as a patient as well. So as you talk to your friend and sister, Ms. James, what are you going to think about, okay, in terms of having that conversation with her? So to talk, to advise her, to counsel her, and say for her to be a stronger advocate for her health. What I want you to reflect on as we continue with the rest of the conversation this afternoon is, what is one important thing that she needs to know before she goes to her visit, okay? So I want you to kind of think about that. Think about one important thing she needs to plan to do during that visit, okay? And I want you to think about one important thing she needs to do after her visit, Okay, so if from our counseling with her, she can take away 3 important strategies: what she needs to know before the visit, what she needs to plan to do during the visit, and then what she needs to do after her visit, I think that would be a constructive, engagement for her as it relates to her conversation with us. Okay. So let's continue on. We talk about, you've heard me say self-advocacy. So what does that even mean? So there's a definition of self-advocacy out there. In other words, what does it mean to be to advocate for oneself? It means the ability to seek, to evaluate, and to use information to promote one's health. Okay, there are many definitions out there, but this is a simple one, right? Like, how do we find the information, and how do we evaluate information? Because as we well know, not all information out there is to be used, right? We know that very well. There's a lot of misinformation, disinformation, misconceptions, myths, and straight up lies out there. So it's the ability to not just seek, but to evaluate, to be able to say, nah, this is not credible, don't believe this, and oh yeah, this is credible, it's founded on good science or good evidence, right? And then how do you take that information and then apply it to improve and promote your health? So there are multiple levels to it, right? And so, and why is this important? Because to manage one's health, and if you have actual current medical conditions, to manage those conditions, okay, and to survive through those conditions, to thrive through those conditions, it is necessary to be a self-advocate. It is an essential. Essential means critical, necessary to be a self-advocate. Another way you can say it is that folks that don't advocate for their self, they don't do very well. They don't. They don't do very well with their disease management. They don't do very well in terms of outcomes, okay? They don't survive. So it is critical to be able to advocate for oneself, all right? So then let's talk about, well, why don't we necessarily have advocate for ourselves? Why do we have some challenges advocating for ourselves? So I want you to know that the literature does show, especially for us Black people, and particularly Black women, we have lower rates of self-advocacy. In other words, we don't advocate as much as others, and there are reasons for that. Let's talk about some of those reasons. One could be lack, and this is for anyone, right? But particularly as it relates to us, okay? So why would there be low rates? Why would someone have difficulties self-advocating, right? But especially, particularly as it relates to us. So one is lack of knowledge or understanding, just not knowing, not understanding one's illness. Okay, so Miss James, she may not understand that she has diabetes, or that what does diabetes mean. That is like it's a life-threatening disease, and it causes so many problems, and it basically leads to death, premature death. She may not understand, we're not saying that's what's going on, but that could be a reason, right? Like, just as we're trying to understand where she's coming from, or anyone like her. Okay, now we might say, but she's a school teacher and she's getting her master's, she's well educated. I want you to know that education doesn't mean someone is health literate. One thing is to be educated or to be literate, like you can read, you're educated, you can read, you can write, you can do arithmetic, right? It's another thing to actually have literacy or understanding when it comes to health and managing your health. A whole lot of folk who are well educated, they got letters behind their names, but they have poor understanding of their health and their illnesses. Is so important. And so there could be lack of knowledge of what does diabetes mean, what does asthma mean, what does the disease process mean, or understanding of health, because it really is a skill set to understand health, all right, and understand disease. It really is, and requires some degree of training. Okay. The second could be personality. Some folks, if they have, they're timid, they're sort of, it's not easy in general. They say they're introverts, they're shy, they're timid. So that could be an issue. And so they don't speak up, they don't ask questions. That's just how they were made, or that's just the result of their life experiences, or that's how they were raised. Don't ask questions, stay quiet, don't question authority. That could be what they were told. And so that's how they operate as adults. Power imbalance. Let's be frank. in that room, when you come into the healthcare system, when you're sitting in front of that doctor or that healthcare professional, that person has the knowledge, has the training, has the experiences. You're here to get help. That person has the power in that encounter. So there is, everyone kind of falls into a role, the medical expert and then the patient, who is a little bit more submissive. And then the medical expert is the one exerting their knowledge and expertise. So there's a power imbalance that might prevent people then from responding with advocacy of their for their health. Fear from, it could be from intimidation from that power imbalance, or just fear. I don't want to know. It sounds bad. I want to put my head, I don't want to deal with, bad news. I don't want to deal with having a disease. So you could also say that's denial, but denial oftentimes is rooted in fear. So again, anxiety over, again, being sick or having to deal with, again, being with disease and all those concerns, self-doubt. Well, maybe again, that could be rooted in the power imbalance. Well, maybe I'm not, maybe it's me. I'm the one that doesn't understand. I'm the one that maybe if the doctor isn't treating me well, it could just be me thinking that way. It's my feelings. It's not true. It's not real. I'm just too sensitive. So there could be so many issues going on within our heads that prevent us from advocating for ourselves. We talked about intimidation. There are medical conditions. There are many conditions, a lot of the chronic illnesses people deal with, as well as psychiatric illnesses, okay, can prevent us from self-advocating, because it can prevent us from even having the mindset to advocate for ourselves, to ask those questions. There's a lot of studies and a lot of science out there that shows us that chronic illnesses actually compromises the part of the brain and the brain function that helps us to make high level decisions. So a lot of people who have a lot of serious medical conditions, kidney disease, hypertension, heart failure, etc., there is a compromise of our abilities to make those decisions, to make those decisions or have those thoughts, high level complex thoughts, to even ask those questions or understand it when it's told to us. So there will be, again, a challenge in terms of advocating for ourselves. And of course, psychiatric illnesses, schizophrenia, etc. Lack of support. Oftentimes, if we're there by ourselves and we're alone, again, we don't feel safe to advocate for ourselves if we are not in the position to have somebody with us. Sometimes it really doesn't matter having someone with us that can give us the strength to say, I'm sorry, I don't understand. Can you explain that again? And finally, systemic issues. This is last, but definitely not the least. Systemic issues. Okay, let's be frank, let's be real. We are living in a racist society. We are living in a white supremacist society, and medicine and the healthcare system is not immune. Okay, and so just engaging in a system such as that renders us to be tend to be defensive, hyper vigilant. We're spending so much energy just being maintaining our safety, our mental, emotional, spiritual, and physical safety within the system. We haven't even gotten to we don't even have a reserve to start talking about, okay, yes, help me understand about my asthma or we're just trying to stay safe. We're just trying to keep body and soul intact in that space until we get home. Yeah, whatever you say, until we get home. What did he say again? What did she say again? Right? So just engaging in a system such as that is tough. Just trying to get, if we perceive that we're not being treated fairly in general, if we are not being treated valued, or our voice is not heard, why would you, if you feel that system doesn't care about you, what's the point of advocating, right? So you just go there, do what you need to do, and then go home, kind of thing, right? So bias in general, racism, sexism, ableism for those who, for the variety of disabilities that many of us have, okay, whether visible or invisible. Homophobia for LGBTQ family, classism, when medical information is presented in complex language and written when we may not be able to read. or read effectively. We know we have very high illiteracy rates in our city, right? Folks that have challenges reading, but we give it to them. We can't read, but then we have pride. We're not going to say we can't read, so we just take that paper and put it in the pocket, but we don't understand. Okay, accessibility, again, accessibility to appropriate information, accessibility to knowledge about the system, the healthcare system, and what our options are. And how to engage, how to ask a question, what are the side effects of this medication? You know, what are the top 3 complaints that you hear about this medication you're about to start, you know, on me, etc. Right? And so, and when all these factors are working together, individually and together, oftentimes these things are intersectional, meaning they are working at the same time together and they're informing each other. It would definitely present a challenge for folks to advocate for themselves. But I'm here to tell you, as a physician and a Black woman and a Black person, right, is to say that the power is in you, okay? The powerful expert is you as the patient, because you have expertise of your life. You have expertise of your body. You have expertise of your experiences that and your context, meaning the things, how you live, your home, your community, your church, your mosque, your place of worship or not, your place of celebration and recreation, and all the things that you do that all impact upon your health. See, remember I referenced social determinants of health earlier. Social determinants, again, are those conditions in which we live, work, play, go to school, die, build families. So schools, home, housing, education, income, nutrition, access to healthy foods, etc., incarceration, all those things impact health, right? And contribute 80% to health and wellness outcomes, not necessarily what we do in the clinical setting. So who's the expert of those things? You. So the things that actually impact you, your health and your wellness, and has the majority of the impact, right? The greatest impact is you. So the most powerful expert in that space is you. Now, the medicine and the science, absolutely important and critical. What I'm saying is that it is not higher than the expertise you bring to the room. It is not. It is at least equal. Okay? So the powerful expert in that room is you. Okay? Regardless of all those barriers. All right. And it's so critical because what the data shows us, what the literature shows us, is that patients who self-advocate, they gain the maximum benefit from their encounters in the healthcare system. And remember what I stated earlier, that it is linked to how well we do in managing our medical conditions, in fact, surviving our medical conditions. So how do we engage as we come to the rounding up portion of the conversation? How do we engage in self-advocacy? What are some important strategies? There is a saying, you know yourself, right? And to your own self be true. Know thyself and to thy own self be true. We have to know ourselves. As patients, we have to know ourselves. What is our health status? What are our diagnoses? What are our medications? What are allergies? What are our histories? Personal history and family history. What is the health of our mom and her family? What's the health of our dad and their family? To the extent that we can find out, because for many of us it's different and we recognize that. So have we had those conversations? Often in our families, I know this to be true for me, we don't often have those conversations, right? And so we don't often know. Yeah, Uncle Larry, he just died. Why? What happened? Right? But we have to find out. No. Who do I need to ask to find out why Uncle Larry died? It affects me, mom, dad, right? We have to know our histories, not just where we come from and who we are, which is critical and number one, but also our health, the health of our families and family members and ourselves. But it starts with us. What are your diagnoses? What medications are you on? Are you allergic to anything? What allergy means that you have a response when you take that thing. That response on your skin, it itches, you have hives, you can't breathe. Not that I don't like it. It makes me sick. That's different. But if you have a physical response, that's an allergy. You need to know that. Know your values. What is important to you? Why do you want to stay healthy? Remember, Miss James, her children. I mean, we should care because it's ourselves, but our children, right? Whatever it is, know what is important to you and why you want to be healthy and stay healthy. Okay, very important. Know your healthcare team, and think why. It's not just your doctor, but the nurses, the medical assistant. Do you have specialists? So for Miss James, she probably has medical an endocrinologist, a diabetes specialist. She may have a pulmonologist who is an asthma specialist, as well as her primary care doctor. Know who they are and what they do, and know their expectations, the goals for them, for you. Okay, know your care plan and know your goal. So as a person with diabetes, Miss James ought to know, okay, I'm on insulin, I'm metformin. Okay, I'm supposed to take my insulin like this, my metformin like that, and my A1C, which is the measurement that we use to monitor diabetes, needs to be less than 7. That's what I'm dealing with. So always know, make sure it is communicated and that you understand what your care plan is. Keep it organized. Okay, have a system, whatever system you like. Pick one, go with it. Okay, I'm a paper person. I also use my phone a little bit. I have some apps that help me manage my medical conditions. Okay, and so I do that. I also have paper. I also make sure my husband knows what's going on so that he can kick in when he needs to and help. All right, and so keeping organized, a system that way you write and record and maintain them somewhere that is easily accessible and that you can get to, and that the people in your life know where it is and what it is. Ultimately, you are owning your health because this is you. I tell my patients, I say, ma'am, you are the CEO of your life. And so Miss James, you are the CEO of Miss James Incorporated. I'm your CMO. That means I'm your chief medical officer, but you are the chief executive officer. I am here in your service. Okay, is what I tell her. So it's so important. If you are able to take a loved one with you when you go to your medical encounters, there's power in numbers, and we are communal people. So just having someone with us helps if you are able. I know it's not everybody is in that position, but I'll tell you that there are some advocacy groups and support groups out there, depending on your medical conditions or otherwise, where they will provide someone to go with you. Okay, depending on what's going on with you. Communicate clearly to your healthcare team. All right, know your team, clarify expectations, and as we've said, develop a shared care plan and maintain records. But I want to say, develop that shared care plan built to your goal. There's something we call shared decision-making model, right? So whatever the care plan is, it should be from the patient and the physician or the healthcare professional together, saying, this is what is going on. This is what is important. Let's talk and get to a place so that this goal we're coming up with has some of me and some of you, so that you are owning the care plan. This has to be your plan. All right. And so it has to be shared, both healthcare team and you working together in service, because you are the CEO and we are the CMO. But the company is your company, right? We're working together for the ultimate outcome of your health, the best health that you can. I can't stress this enough. Ask questions, write them down, write them on your phone, write them on a piece of paper or a book. I encourage my patients to do both. I love questions. It helps me to help them better, okay? Communicate your observations and ask for explanations. If you notice something isn't going right, you better let that healthcare professional, you know what, I'm sorry, man, I'm feeling disrespected. Could you please help me understand why you can't answer the question that I just asked you? I'm observing that you are in a hurry. Am I able to ask a question? Because I don't understand why you are increasing my blood pressure medicine. You know, tell them what you're observing and ask for explanations. All right. Assume best intent. Most of us, regardless of how it may come across, but most of us as medical professionals are in this for with all the best intent, for all the best reasons. For a variety of complicated reasons or complex reasons, folks may not be doing what they need to be doing that day to the best of their ability. So we might need your help to remind us to get centered, to get grounded, and come back to focus and come back to mission and be present for you. So this is very important. Teach folks how to treat you and how you like to be treated, and always be honest and open. Okay. And in honesty, the other thing too, if I didn't mention, to write your questions down before you get to the encounter, so that it's clear what you want to get out of the encounter. Okay. And I'm gonna summarize because the time is heading out from us. But it's important to understand that we are living within a basket of history. We have to understand that. All right. It's the truth. There are historical harms that have been perpetuated against our community, and they still bear out in today's way of doing things. So it is important that we have to acknowledge that in that medical encounter, those forces are influencing things. And so being honest and open with it. I've had patients, but most of my patients look like me. So they're more like, hey sis, you know how they do us. And we can have that open conversation because we share a commonality, right, in our background. We share common background. But it is important sometimes, and especially my older patients, they'll just teach me, well, not too long ago we couldn't vote. I'm like, yes ma'am, you're right, we couldn't. And we have that conversation. They teach me, and they say, so you understand that's why it's difficult for me to listen to that person or that, because oftentimes I find myself, well, not oftentimes, almost every day, advocating on behalf of my patients, but to really break down and interpret for others why my patients may be may have a certain approach to the care, because there's a history that's still informing the present. So we have to get honest about that. I want to also encourage you to get involved with healthcare training. When the community teaches physicians and healthcare professionals and physicians are better at serving the community. So if you are able to get to participate as a standardized patient, to teach medical students and residents, to serve on patient panels as part of the medical education system, to participate with community organizations and faith-based organizations like churches, to bring medical folks to the church, or to again attend medical classes and nursing classes, to again teach and share your expertise, which is your experience and your life. A lot of different research organizations have community advisory boards. So if you're able to participate in those, that will be an amazing opportunity to inform and help in the current and also future healthcare professionals to be better. Always on the repeat, how at the end of your visit, summarize your understanding of your visits to your doctor. To be sure, as a healthcare system, we need to do better. There's no question about us. Ultimately, we should create conditions so that you don't have to advocate for yourself necessarily. You should be in a condition where you could just be cared for. Okay, yes. Until we build that world, though, there is a need to advocate. And so yes, and so we need to be working on that. Very quickly, what if it's not working out? You don't think you're getting what you need? I want to encourage you, you can always ask for a patient advocate from that system. You can engage in the reporting systems of that institution or organization, and you can change providers. And I acknowledge that it's not that easy to do that. There's a lot of barriers to that. But if that's something that but understand that that's an option for you. I think that's what's important. You can also engage the assistance of patient advocacy groups and organizations, and there, excuse me, many of them out there. You can find them online. They may be in accordance with your healthcare needs or otherwise. So remember those questions about for Ms. James that we said, you know, one thing, what is one important thing she needs to know before the visit? You know, she needs to be clear on her values, her goals, her expectations for her healthcare provider, know her medications, her history, her diagnosis, her allergies, all that stuff. Okay, she needs to write down her questions that she has for her healthcare professional. What she needs to do, plan to do during the visit is to not only listen and pay attention, but to ask questions. Ask questions. Well, what did you, when someone examines you, what did you find out? When someone checks your blood pressure, what is it? What does it mean? Ask those questions. And after her visit, at least one important thing she needs to do is to write down her understanding of the visit and her goals against the next visit and what her care plan is. In conclusion, I'm with Wayne Health. We have free blood pressure screenings and A1C screenings for diabetes, okay? If you just email or go to the website or call 877-WAYNE-HC, you can, and just say screenings and that you heard about this with at the Black Health Summit with Dr. Opara, you will be able to get free blood pressure and free diabetes screenings with us. Okay, this is the information. I'll make sure that the organizers have it so that they can disseminate it to everybody. And with that, I want to thank you for your attention, and I will open up for questions, which means I will go into the Q&A and find out what questions you have. Before I do that, or while I'm doing that, I want to ask the organizers to help me, to give me a sense of time and how much more time we have. I'm going to stop sharing. Okay, so we have some questions here. Okay. Lillian asks, considering the recent news with the African American, let's see here. Okay, 1 second, let me find out about my time allowance. Okay. Lillian asks, considering the recent news with the African-American doctor that recently died of COVID in Indiana, what can patients do to prevent tragedies like this? For example, who do you talk to when you can't get answers about your care or your loved ones? And I hope I answered that already. Yes, Dr. Susan Moore was an African-American woman who, a physician, by the way. So you can see, that's why I say I'm a physician, I'm also a patient. So this issue of self-advocacy matters regardless of our professional background, okay? And so patients, like I said, self-advocacy, and she was able to advocate for herself as a matter of fact. And so she asked, she escalated, she said she got the patient advocate involved. She asked to speak to the chief medical officer of the institution. And once they got involved, things changed. The doctor was changed, her team was changed, her care was optimized. So she basically asked for what she needed and she got it. And like I said, in terms of prevention of these tragedies, what I would say is the more patients on, when I say patients, the community demands that the healthcare system in their communities gets, that these kind of behaviors are not going to be tolerated by the community in which these healthcare systems live, the more things will change. So in terms of preventing these tragedies, I would say that the prevention starts outside of the healthcare system, like outside of the hospital. It is the surrounding communities rising up and demanding that that hospital or that healthcare system, it's not okay for those things to happen in that hospital, in their community. That's what I would say. So those preventions are, the preventive action has to happen outside of those, of all right, so I've just been told that the next session has started. I'm so sorry that I wasn't able to get to these questions right now, but I will save them. and I will make sure I send answers to the organizers to disseminate. I want to thank you for your time, but please go ahead to the next session because they need you there. Thank you so much for your time.